Good evening. Hi, I'm Dr. Mondesir, physician owner of Optimal Care Pediatrics located in the St. Lucie West. And I am going to let the doctor introduce herself.
Hi, I'm Nicklaus. Palau Collazo. I'm a pediatric endocrinologist with Nicklaus Children's Hospital.
So today we are going to be talking about growth issues in children as well as diabetes. So our first question, what is a pediatric endocrinologist?
So essentially, I specialize in kids that have disorders with the endocrine system. So essentially hormones. So for example, kids that have growth hormone problems, they can have thyroid issues, very early or late puberty, pre-diabetes, diabetes.
What's growth hormone?
So growth hormone essentially is produced by our master gland, the pituitary, and that's what helps kids grow. So sometimes when kids do not produce enough growth hormone, they tend to present with very short stature.
Okay.
So that's one of the conditions that we can help diagnose and treat.
Okay, excellent. And what type of training does a pediatric endocrinologist have?
So we usually do the 3 years of general pediatrics, and then afterwards we do another fellowship for 3 extra years to learn more about just the endocrine system.
Okay.
So I did my training at Yale, and we excellent program. We did part general endocrine and then part of diabetes training separately.
Wow, see, I did not know that. And what types of cases do you see?
It varies. It's very different. So, I see a lot of kids for problems with growth, like short stature. I tend to see a lot of problems with obesity, insulin resistance, pre-diabetes. I have my fair share of patients with type 1 or type 2 diabetes, thyroid issues, puberty, kids like girls that have problems with their menstrual period. Sometimes they have irregular menses. So anything that deals with the hormones, that's what I treat every day.
Okay. And I get this question a lot. When should parents be concerned about the height or growth of a child?
So that's actually a pretty good question. I would say, if the kids are not growing the normal amount per year that you would expect, that would be concerning. So usually kids after the age of 4 grow approximately 2 inches a year, and then once they go into puberty, they grow anywhere from 3 to 5 inches. So if you see that, your child is growing less than 2 inches per year, or they're falling on the growth percentiles, that would warrant, a visit to a pediatric endocrinologist.
Okay. And then what age do children stop growing, like for boys and girls?
So that's a very cool question, and that depends on when they go into puberty, right? So let's say that they go into puberty on the early side, they're going to stop growing sooner than if they're delayed, then they're going to grow much later, and those are like the late bloomers. So usually we can tell more or less by a hand x-ray, which is called a bone age. So essentially we're able to see the growth plates and know, in terms of development, how much time they have left of growth. So usually a girl has completed their growth when their bone age is around 14 to 15, and a boy when the bone age is around 16 to 17, that like 98% of the growth has been completed.
Okay, and then we're going to back up. What are growth plates?
So the growth plates are the areas of active new bone growth. So most of the time they're located at the end of the long bones.
Mm-hmm.
And like I said, we tend to do a hand x-ray, and that's where we can see how much growth potential a kid has. So I usually tell the parents it's like knowing how old a tree is. So if you want to know how old a tree is, you have to cut the tree and count the rings inside.
Mm-hmm.
So in order for us to know how old we really are, we look inside and we look at the bone. So let's say a kid could be 7 years old, but his body might think he's 5, and that's why he looks much shorter. Or let's say that they have early puberty, and then despite the fact that they're 7, their bones can think that the kid is 10, and then, that can interfere with the growth, and then they end up being a little bit shorter.
I like that analogy. And then when can a girl expect to stop growing after she starts her menses?
So usually they grow like 2 to 3 inches after they have a period.
Okay.
So it varies, but it's not significant amount of growth, but they still grow at least 2 to 3 inches.
Okay. And we talked about what growth hormone deficiency is, but how is it diagnosed?
So with initially, when you come to the visit, if we're seeing you for short stature, we need to do like a complete assessment of the child, right? So we don't only look at problems with growth hormone, we make sure that there's not like a thyroid deficiency, that the kidney and the liver are working properly, that there's no anemia. We also do a test for something called celiac, which is an allergy to wheat. And sometimes kids do not present with symptoms of like belly pain or bloating or diarrhea. They just simply don't grow well. So after all is said and done, and we look at everything and we see that everything looks good and remarkable, let's say that the kid is still not having good growth, that the growth is still poor, we do a growth hormone stimulation test. Let's say that in the initial assessment, we look at the growth factor. So I usually don't measure growth hormone because growth hormone is secreted in a pulsatile fashion throughout the day. So I cannot say, take Susie to do the blood work at 9 a.m. because she's going to be producing growth hormone. Like there's no way for me to tell. So we measured another product of the growth hormone called the IGF-1. And, if that level is normal, then you can more or less say then growth hormone production is normal. But if that level is low, then I go straight to the growth hormone stimulation test. And in that test, I usually do it at the hospital. It involves an IV and frequent blood draws. So we give the patient one medication, measure the growth hormone every 30 minutes for 90 minutes, and give them a second medication, and then again measure the growth hormone every 30 minutes for 90 minutes. And if their growth hormone level is less than 10, then it's suggestive that they have growth hormone deficiency. And then we can start treatment with growth hormone.
Okay, excellent. Good explanation. And what are some of the signs of diabetes in a child? So we'll often get parents kind of rushing in and thinking, test this child for diabetes. So what should we be looking out for?
So, the most common ones are drinking more than usual, peeing more than usual, getting up in the middle of the night to drink or pee. Usually you see kids that are already potty trained start having accidents at night. And then some kids have weight loss despite the fact they're super hungry. And when it gets more severe, they start complaining of belly pain, nausea, and vomiting also.
Okay. Is there a family history usually of diabetes?
So that's very interesting. So it depends because kids that have type 1 diabetes, 90% of them have absolutely no family history. So most of the time it takes people by surprise, right? But then type 2 diabetes has a more strong genetic component, not as common in children, but we also see kids with type 2 diabetes. So they usually present with them drinking more and the peeing more too.
Okay. So you mentioned type 2. Tell me the difference between type 1 and type 2 diabetes.
So type 1 diabetes is a chronic autoimmune condition. So essentially the immune system, which is supposed to be helping you fight something that doesn't belong to you. So I call it like the army. So instead of fighting like a virus or a bacteria, it starts attacking something that belongs to you. And in this case, are the cells that produce insulin in our body, and those are called the beta cells. So it essentially is just destruction of those cells, and you're no longer producing insulin. So that's why we need to replace it with insulin. Type 2 diabetes is mostly when your body's still producing some insulin, but not enough to make your blood sugars be under control, or sometimes it just doesn't respond as well to your insulin because it's already resistant to it.
Okay. And is one worse than the other?
I'm going to be honest. I don't think that there's one worse than the other. I think there are different types of treatment for both. So for example, with type 1 diabetes, it has to be insulin. There's no other choice. And it's a medicine that has to be injected. So sometimes people see it as something worse because it involves injections. But in kids that develop type 2 diabetes, depending on how they are on presentation, if it has been for a long time and their A1C is above 9%. The A1C is the average of blood sugars over the past 3 months. So if that's elevated, we still need to treat with insulin. So regardless if it's type 1 or type 2, usually in kids, by the time they present, we start them on insulin. So we usually measure antibodies, and those are the substance that our body produces that we can measure in the blood of the immune attack. So if those are positive and we see that in terms of clinically, the patient has type 1 diabetes, then we keep the insulin. If we see that it goes more with type 2, usually those patients are obese. They have darkening of the neck area. That's called acanthosis. So in terms of clinically, they present a little bit different. So once those antibodies, if they're negative, then, we start them on a pill. It's called metformin. And then we can start trying to taper off the insulin. In reality, research shows that type 2 diabetes in kids tends to be a little bit more aggressive, and sometimes even within 2 years of diagnosis, they end up using insulin anyways. So I'm not going to say that one is worse than the other. I think both, they need to be taken care of. And, type 2 diabetes probably is a little bit more manageable because your body still produces some insulin versus type 1, but we both need to pay, good attention to both of them and take good care.
Excellent. And is there anything that a parent can do to prevent a child from getting diabetes?
I think that's the hardest thing, right? As parents, we sometimes feel guilty when things happen to our kids. And with type 1 diabetes, there's absolutely not a single thing that you can do to prevent type 1 diabetes. And that's like the one thing that I always tell them, my parents, as soon as they come to the office. Because some parents think it's because they didn't breastfeed too long or, could have been the vaccine. Like, there's so many different theories out there. And in reality, we still don't know what is the cause of type 1 diabetes. We know that people are genetically predisposed to develop the condition, but then something else happens. And what is that something else? We still don't know, that makes our immune system working properly and start attacking.
So the parents did nothing
wrong.
There's nothing different that the parents could have done to change the course or the diagnosis, and they're not bad parents.
And they're not bad parents.
They're awesome.
Yes. And with type 2 diabetes, in reality, it's, can we prevent it? We can help prevent or delay it with good eating habits. Unfortunately, we have seen the rates of obesity increasing significantly in kids. It is estimated that 1 out of 5 children in the U.S. is obese. And that is a risk factor for developing diabetes. If you have a family history of diabetes, then it makes the kid more likely to develop diabetes. If you see that your kid has a problem with the weight and they start having darkening of the skin around the neck, the underarms, that's called acanthosis, makes them twice as likely to develop diabetes in the future. So type 2 diabetes, I can say that yes, we can help prevent it with healthy eating habits and lots of exercise. But type 1 diabetes, absolutely, there's nothing that they could have done to prevent it from happening.
Okay. And how does a diabetic diet differ from a typical diet?
So, that's a really good question, because what I tell my parents is that as long as they're taking their insulin, I do not restrict their diet. They need to be kids. Are they going to have cake once in a while? Absolutely. Are we going to have cake every day? No, but in reality, that's for any kid, right? So I just say, with type 1 diabetes, definitely is way more manageable when we make healthier choices. But it's not that I'm going to restrict and say, no, you can never have candy, you can never have cake, you can, as long as everything in moderation and as long as they're taking their insulin and counting their carbs, I think they can just eat what they want.
Excellent. All right. And what sort of resources do you offer for families whose children have diabetes?
So I do have a full-time diabetes educator in my office, which is great help. So definitely she's a big resource. So when you come and meet me for the first time, you see me and then you meet her, and you go from A to Z, from either how to check blood sugars, give insulin, how to count carbohydrates, how to calculate the right amount of insulin. So definitely a great help. And I think also in our area, we have a good chapter with the Juvenile Diabetes Research Foundation, and they provide a lot of support for the parents.
Excellent. Do you know of any other support groups or for families?
I'm going to say there's a Facebook page for kids in our area that have type 1 diabetes. So I know it's a very close-knit community, and once one is diagnosed, people rally and
Awesome.
and support them. So I would say, you can look through Facebook too and see.
Find the group. Excellent.
Yeah.
Okay. And any closing comments for us? Any take-home points?
I'm going to say, you're a fantastic pediatrician. As your pediatrician, be an advocate for your kid. If you're worried, don't be afraid to ask. There are things that we can help with if we catch them on time, but then, sometimes we are afraid to ask, or we come in too late and then we miss the boat, and then we can not help. So for example, if you have a kid that has obesity, make sure that we start tackling that problem now so we can avoid complications later. So if you start seeing that darkening of the neck, that's worrisome. We want to take care of things now. If you see that, your kid is not growing at least 2 inches per year, ask your pediatrician, is this something that I should be concerned about? Should I be checked out? In terms of puberty, for girls, they should not be having breast development or pubertal changes before the age of 8, in boys before the age of 9. So if those things are happening, that you're seeing that, they're developing hair, adult body odor, and they're at a very young age, ask your pediatrician. Parents have to be advocates, right?
And you don't even have to wait till the well visit.
Correct.
You can just set an appointment and come in.
Absolutely.
If the well visit wasn't due.
Absolutely.
Thank you so much.
My
so
pleasure.
much good information.
Oh, thank you for having me.
Thank you. Well, take care. Have a good evening.